You were speaking at WHX Tech. You were talking about the preserving human connection in the age of AI. So if you can, you just give us a preview of the key message, what it was, and why this team is so important right now.
AI is wonderful. We have to put that out there. I'm an AI enthusiast. I do think we're entering a moment where we have put a lot of energy behind the use of artificial intelligence in a variety of different settings in our lives. AI is kind of the next wave of digital transformation or digitization of our lives. And so one of the key messages that I offer is that data really, you can think about it in terms of our recorded experience, right? So we're encapsulating our recorded experience, using it to help train models and so on and so forth. And that we loosely refer to as AI. Of course, we can do synthetic and what have you, but at the end of the day, that's kind of what we refer to as this idea of AI. AI can be impersonal, however, even though it's capturing a lot of our recorded existence. When it comes back to us in digital form and virtual form, that's an impersonal connection at that point in time. And so the key message that I wanted to offer, particularly to this group of healthcare professionals on both the clinical and non-clinical side, is that I really see them, when you talk about clinicians being at the front line, I see them being at the front line of human to human engagement. And it's so important that we preserve that part of what they do, because I think it's central to healing, which at the end of the day, the healthcare industry is about healing us, particularly healing us during some of the most vulnerable moments in our lives. And so we can, cite different studies and what have you, but I think we all kind of intuitively know as humans that there's very little that replaces a touch. There's very little that replaces a sympathetic voice. And so as we are moving more into seeing AI as an assistive technology in the healthcare space, I just think it's really important that we don't get seduced by its ability to make that space more efficient, by the ability of AI to, in some ways, mimic us, but rather to use it in ways that help us be efficient and expand our capacity so that we can preserve that human-to-human engagement and truly do the human-to-human healing that healthcare really is all about.
Okay. So similar. I mean, as AI becomes more embedded, in healthcare. So what are the biggest ethical challenges you see in ensuring technology enhances rather than replaces human connection in patient care?
One of the biggest ethical
challenges. Yeah.
The AI is an applied technology, right? And we see it showing up in healthcare in a variety of really reasonable settings, scheduling, revenue, administrative, those sorts of things, where quite frankly, getting some of the administrative burden off of our plates really is important. Where this becomes much more ethically challenging is when you start dealing with it on the clinical side. Look, there's a lot of really good reasons why a patient might want to go and investigate a condition, let's say. There are a lot of good reasons why a physician might want to learn more about that same condition, because physicians have limitations as well in terms of their knowledge and expertise. Where we find potential ethical dilemma, in my opinion, is when the results of the research is coming back to me in the form of automation as opposed to in the form of human being. Kind of goes back to that human-to-human engagement comment that I gave you earlier. There are other very obvious ethical challenges, which is, do we apply AI in areas where we have to make a critical decision about life or death? Probably don't want to leave that up to a machine right now. And I'm sure, there are a number of other examples, but at the end of the day, if healthcare is about healing, healthcare is about making choices in some very vulnerable times, for me, I'd much rather deal with a person than to deal with a bot. Because there's just a level of soullessness that comes with a very impersonal technology. And we've not gotten there yet to where we can embed AI into something that feels like an animated being that we care enough about to tell us, something about who we are and what our conditions are and so on and so forth. So I'll leave it at that. I don't want to get too dystopic.
Right. Right. So how can healthcare organizations strike the right balance between, say, automation, efficiency, and the empathy that patients expect, from human interactions?
Yeah. So I think it first starts with understanding that you're in the human business in the healthcare, right? We talk a lot about human centricity in this space, and I think it's one thing to give words to it. It's another thing to put it in practice when you are confronting the very real constraints of more patients than physicians, and increased workloads and increased cognitive loads. And what AI does is to help you to minimize some of that cognitive load, as an example. I think in terms of what we refer to as ethical inquiry, 3 really basic questions: for what purpose, to what end, and for whom might it fail? And I think those 3 really basic questions help us put technology in its proper place. So as an example, I'm going to use AI to do fill in the blank. Help me with a surgical decision. Help me with, scheduling patients, you name it. What's the purpose behind the implementation? If I don't have justified purpose, maybe I shouldn't do it. Because sometimes AI can turn stupid processes into calamity. So we probably shouldn't. Sometimes it can help us to identify where things are breaking down. Maybe we should go and fix those breakages and then automate, right? So for what purpose? To what end says, how am I going to measure success here? How do I know when I've had enough? How do I know when I'm done? If we can answer that question before we implement the technology, it's a good thing. And then finally, for whom might it fail? It's kind of easy in the healthcare setting to say that the most vulnerable person in the context of healthcare is the patient, right? And so if we can anticipate potential failure modes by using technology, AI or any other kind, then we should do our level best to remediate those potential failure modes before we do full-scale implementation. Now, what that does not suggest is that we can accommodate for all potential failures. We just can't. We can't foresee everything, which means then that we have to build in the ability to respond to failures when they occur. I refer to that part as response ability, ability. So we've got to have the ability to respond, which means we've got to anticipate when a failure occurs that we didn't originally anticipate, and then what we do during times of failure. This isn't new, right? You talk to a surgeon, if I'm putting a tool into a blood vessel and something goes wrong, I have procedures and protocols for remediating that. And so the same should be true when we're thinking about implementing AI in the clinical settings as well.
Now, in your role in AI, in SAS, so you focus on data ethics, right?
Yes.
So what frameworks or practices do you recommend to ensure that AI adoption in healthcare is transparent, fair, and say even trustworthy?
Yeah. So we prescribe what we refer to as the quad. Some might refer to it as an AI maturity model. And really there are 4 pillars. There is this idea that I like to promote, which says that trustworthy AI has to start before the first line of code. And that's just my phrase for let's make sure that we think about how we're going to activate the technology before we implement the technology. And so that requires this kind of four-pillar approach. The first is oversight, which is what it sounds like, right? Making sure that we have ample means of determining how we want to govern this particular technology. The second piece is operations, which is to say, if we put it into an environment, how do we intend for it to work? What's the intended use case? And there's a lot more to these, and so I'm just giving you the high level. The third piece is kind of the regulatory aspect, making sure that we are adhering to not just kind of federal policies, as an example, but also internal policies. There are evidence-based policies in hospital systems, as an example. And then last piece is culture, and that's the part that is oftentimes overlooked. You know, implementing AI is as much about people transformation as it is about technology. Right? We've got to make sure that people have a sufficient level of literacy around the topic, how they should use AI for their given role, when they should not use AI for their given role. But even beyond that, Rajiv, it's about getting people to a level of acceptance, particularly when we start talking about clinicians, right, who, you know, have learned over years and grown expertise and wisdom over years. And, you know, we've done some studies with our partners at Erasmus Medical Center over in the Netherlands showing resistance to using AI in certain clinical settings from doctors, primarily because they feel like this thing doesn't know what I know. And that's okay. But one thing we all know is that it has a vast array of knowledge that an individual just can't contain. And so getting that tension resolved becomes really important. And that's a cultural, transformational conversation. That's a change management conversation. And in my opinion, that's the conversation that is the make or break in terms of kind of AI or agentifying an organization literally around the world, healthcare or not.
Yeah. All right. My last question. So looking ahead, what role do you believe healthcare leaders in the Middle East region can play in setting global standards for responsible human-centered AI?
Well, I tell you what, if what I've been hearing over the last couple of days is any indicator of what is actually happening, what I am hearing is a really compelling vision for the future of how digitization and AI in particular can help drive scale and expand capacity of a society. When I hear Her Excellency talk about no longer being about diagnose and respond, but instead going to predict and prevent, that's powerful. You know, if you can imagine a time when you've got a digital twin, as she talked about, of your body, and we can see kind of its atomic structure and its cellular makeup and be able to predict that you might at one point in time face a potential life-ending condition. Wouldn't it be great to understand that early on and be able to remediate early on? Obviously, we've got to make sure that there's accuracy. Obviously, we've got to make sure that there's adequate privacy and all the other things that go around that, right? How insurance companies will behave, and all of these things are very, very important topics. But at the heart of healthcare is healing. And if we can find ways to predict and prevent rather than to treat after a condition has presented itself, I think we make the world a better place.